We need to talk about infertility because so many people struggle with it. And for me, it's personal. My sister is dealing with it. That's why we're here in Hollis, Queens, where we grew up. This is the house that my brother, sister, and I were raised in. Adele and I are 18 months apart, so we shared a room and pretty much went everywhere together because I would follow her. Our experiences were much the same, but when we hit puberty, everything changed. Mommy would take you to the emergency room sometimes. Your pain was so bad, and I never quite understood why yours was so bad, and mine just made me like maybe curl up in a ball and want to go to sleep.
When I was 13, I remember waking up and it was just a pool, just everywhere. And I would be crawling to the cabinet to try to get as much painkillers as I could.
We thought her symptoms were just a normal part of life, nothing more.
The women in our family would sit by the kitchen table and then everybody would just tell war stories about their cramps and the worst cramps that they had, and it felt better, and you just feel like, well, this is part of womanhood, and then that's it.
Fast forward a couple decades, Adele's pain intensified as she and her husband, David Bong, worked overseas in refugee camps in South Sudan. They're humanitarian workers.
For Adele, it was something that was normal to have this pain. She wouldn't have told me unless I had noticed, and when I noticed Adele having some of these intense moments of pain, is she would almost come to a point where she looked like she would faint. And it just seemed to be more frequent that this was going on, so I began to really worry.
Not finding answers from doctors in Africa, Adele and David returned to the U.S. in 2017. She was referred to a fertility specialist after a gynecologist suspected her pain was due to something more serious that could further complicate her desire to get pregnant at age 37. She was finally diagnosed with stage 4 endometriosis. The lining of her uterus was growing on the outside, causing her severe pain and also infertility. 12% of women in reproductive age have infertility. That's 7 million women. About 20% of them have no known explanation, and the disease is just as common in men. The issue is many, like Adele, find out they are infertile at the point of crisis, when they're finally ready to start their families.
We want children, but my main concern was always, we need to figure out what's going on with your body.
Adele's doctor, Lauren Johnson, cleaned out some of the endometriosis scar tissue surrounding her reproductive organs last summer to ease her pain. But she'll need the additional help of in vitro fertilization, or IVF, to get pregnant.
So then the next part is going to be what's going to be the most intensive part, okay? So what I'm drawing is a timeline for about the 2-week process in which we're going to get the eggs to grow and develop. All right, you ready?
With IVF, daily hormone injections are used to stimulate egg growth. They're extracted, fertilized, and then physically placed inside a woman's uterus. Her eggs were, how were her follicles? Were they damaged by the scar tissue too much?
So I think for you, it was more the issue of the endometriosis impacting the back of the uterus and also the bowel,
Yes.
and less of an impact on the ovary. An AMH level was good for you.
That
Yeah.
means that I'm producing enough eggs, because that's also a reason for infertility, when people are actually not producing enough eggs. So I remember thinking, well, at least there's a bright light in a dark tunnel.
Based on your situation where you are now, your egg numbers, your sperm count, I think the chances for you guys are going to be very good.
At first, IVF was out of the question for Adele and David. One cycle can cost upwards of $20,000.
There is IVF, but it's not for you, because you don't have the means to do that. You know, I would like to think that I was wise with my time. I went to school, tried to work hard, get a decent job, tried to be responsible. We worked very hard to pay off our school loans. Finally got stable so that we can have a house. And then you get to that point, and it took you too long to get to that finish line.
Just 25% of employers cover IVF cycles through their company's insurance plans. There are very limited funding options outside of insurance coverage available. Dr. Johnson suggested Adele apply for grant funding through the Bundle of Joy Fund, a charity created by NASCAR couple Kyle and Samantha Bush, available right now only to couples seen at Reach Fertility in North Carolina.
How are you guys? I'm Samantha. Nice to meet you.
Just seeing all the good they've done, and they're so selfless, and they help so many other people, and so we just wanted to be able to give them what they do to others. So we started the Bundle of Joy Fund shortly after we had our son Brexton. We had to go through IVF. We struggled for many years, found that it was our only option because I had PCOS and my husband had low sperm count and quality, so IVF was the only way we were going to have a child. We really felt like God placed it on our hearts to do more, and we just really understood that the whole process is overwhelming. It's stressful, it's emotional, it takes a toll on your marriage, your body, everything.
You had access, but most people can't access that. Yeah.
I mean, Kyle and I felt very fortunate that we were able to pay for it, but we've heard of so many couples that have worked 3-4 jobs, sold their house, moved in with family members, sold things, did GoFundMe pages, all these things for years just to save up to try one time, and there's no guarantee, and that's the hard part.
Bundle of Joy has helped 37 families in the Charlotte area. 16 babies have been born, with 7 more on the way. Samantha says she hopes to see IVF covered by insurance sooner rather than later.
There are so many people that would be amazing parents that are suffering in silence and that will never have the funds to be able to go through IVF, and that has to change.
And that is literally where you take one sperm and inject it into each egg to fertilize it. The next day we're going to call you and tell you how many are fertilized.
Adele and David will essentially get one shot at IVF, one cycle, with Bundle of Joy's help.
For what we've been given already, it makes it possible. Beforehand, it wouldn't have been possible.
At all. Any
I think it would have been too big of a risk, whereas we have the leverage to take that risk. But it's still a risk, it's still a sacrifice, and which is okay.
And we're grateful that it's even on the table.
Assisted reproductive technology has come a long way. 30 years ago, 5% of IVF patients delivered healthy babies. Now more than 30% do. But that's far from a sure bet. Adele and David hope to be pregnant within a year, and if the cycle fails, they'll probably move on to adoption. You're excited?
I'm excited.
Because this is like, finally you have answers, finally there's a path, finally there's a plan ahead, and we're gonna just chug forward.
We're gonna see where it takes us. And either way, whether it's successful or not, we're grateful.